It's important for the city and for us to be advocating and doing everything on our part to make sure that communities and groups that have been disproportionately impacted, low income, minority communities, communities of color, that they are in the first part of this as much as possible. Because that's where I think we need to focus on where the disproportionate impact has occurred and make sure that once you get past the healthcare providers and your first responders, that these communities that have been disproportionately impacted, communities of color, low-income communities, that they are right there in the mainstream of distribution. So that has to be very intentional. That has to be a part of the matrix right now at the very beginning as a part of the planning and not come in on the back end. Otherwise, more people will be impacted and more people will die. So I just want to say that at the very beginning, before one vaccine is disseminated, and it's important for the state. It's important for the state to be in tune with that, to make sure that the distribution, once you get past your healthcare providers and first responders, that these communities of color, where there's been a disproportionate impact, that those vaccines are distributed to those communities at the very beginning.